Yeah. So when you get a new patient, and by patient I mean animal, coming to see you and they are curious about different types of flea and tick preventatives, such as oral medication, topical, collar-based, how do you kind of walk them through what's the right decision for them?
So I think that is all patient client specific. Everyone reacts differently. Every animal reacts differently to each topical or collar or oral medication. So I think that's a big factor that we have to consider, along with what other animals or even children are in the house, right? Because cats can be very sensitive as well to some topical flea and tick medications. So we have to keep that in the back of our head when we're recommending this, along with children, right? If we're using a topical and there's little kids in the house that are petting the dog, we want to make sure that those little kids are not maybe petting that dog and then sticking their hands in their mouth.
Frontline, Vectra, Canine Advantix, those are, they're great, but if there is a cat in the house, they contain permethrin, which is very, very toxic to cats.
Yeah.
The other thing is there's also Seresto collars out there, which are great, again, because they tend to last longer and people don't have to give like monthly or every 3 months, like tablets. So they keep the collar on, but an issue with the collar sometimes is that they don't tie the collars too tight or they leave it on for too long. So it's not as effective after a while.
Right.